A warm welcome to all the participants that have logged on to this webinar. And this afternoon, I am going to introduce myself, Dr. Chibugo Okoli, the Deputy Country Director for Chibugo, and I will be presenting a brief case study of a project that we're doing in Nigeria that incorporates measurement of women's experience of care in maternal health and reproductive health program. I will also be presenting the challenges, opportunities, and lessons that we are learning as we're implementing. First of all, let me acknowledge our donor, MSD for Mothers, the federal government of Nigeria, and the 2 states where we're implementing. The implementing partners as well, Chibugo, MDOC, Health Strategies Delivery Foundation. And just before I go on, I just will give you a brief overview. Our overall goal for this project is to reduce maternal mortality and morbidity from indirect causes by applying a woman-centered quality of care model to improve prevention, early detection, and management of high blood pressure, diabetes mellitus, obesity, anemia amongst pregnant women along the maternal health continuum. These clinical areas are often associated with preeclampsia and eclampsia. The project is in 2 phases. Phase 1 that ran from 2019 to 2020, which is what I'm going to present today. And then phase 2, 2021 to 2022, which is ongoing. So the women-centered quality of care model has actually many implementation approaches, but I'm just going to share 2 of the components. The first component is working with the quality improvement teams at the health facility level to identify quality gaps, set improvement aims, and prioritize quality improvement indicators, one of which is the women experience of care. And the second part is actually to provide self-care support to some of the women registered on the digital platform to help them modify their lifestyles. So for the period of 1 year, October 2019 to September 2022, phase 1, we saw over 26,000 women using the health facilities with support in the ANC. And you can see from this chart that there has been a significant improvement from when we started in October 2019 to September 2020 of actually the proportion of women that are screened for these 4 clinical areas. So last year, in June 2020, we decided that we needed to incorporate the women's experience, to hear from the women about their care. So we set out to assess the quality of antenatal care and women's experience in receiving the services, and hopefully that this will inform the areas of improvement and approaches for regular measurement. We sampled 100 pregnant women enrolled in ANC that at least attended 2 visits, randomly selected them from 10 high volume facilities that are cut across general hospitals, private and primary healthcare. We administered a client questionnaire tool adapted with the permission from our Fulani et al., the 2019 publication. Data collection was done through RedCap and analysis was done by SPSS and Excel. So if you look at the first chart, which actually looked at the women telling us about the care that they actually got from the facilities, you would see that the women's report in accessing the ANC best practices actually aligned with the many measurements that I showed you earlier on. So this was quite heartening, but however, there was still room for improvement and gaps that we needed to work on with the health facilities, such as doing more blood tests for the women at the appropriate time. But above all, provider communication of results remained low and will be targeted in the scale-up phase of the project as part of a larger emphasis on patient-centered care. We also went ahead to ask women questions around dignified care, privacy and confidentiality, communications, and then also facility environment. And again, there's room for improvement, especially around discussing things in privacy in the ANC. Women actually reporting that they felt, feeling of respect at all times, and then feeling treated in a friendly manner in the health facilities. All these results were fed back to the quality improvement teams for them to work on in terms of improving what they are doing. So we also are looking forward to the scale-up phase 2021 to 2022 in incorporating this as a regular measurement. So the facility exits survey that I just described will be extended from ANC to the delivery, PNC, and family planning as well. It will be done biannually. And then we will also incorporate finding out the perception of the women of the experience for those that are actually registered on the digital platform. The program is very, very keen and strives to monitor both clinical care and the experience of care. And finally, there are, of course, a number of challenges, opportunities, and lessons being learned as we move on. So one of the challenges is actually getting the cooperation from health facilities to do routine respectful care measurements. And most of the excuse is that they have staff shortage and they are not able to engage in the whole process. Another challenge is finding an appropriate and convenient place to actually assess the women beyond the facility due to patient bias and location bias. And of course, COVID-19 pandemic challenges has actually had an impact in women's utilization of MH and RH services, but this is improving. So one of the lessons we've learned is that regular measurement of RMC is essential because it actually helps to improve quality of care at the facility level. We also now know that it is possible to monitor and improve quality of care and clinical experience of care and quality of care at the same time in a maternal and reproductive health program. Stakeholders and facility involvement is so crucial because we know that a collaborative process actually helps with acceptance of results and willingness to actually work on the needed improvements at the health facility level. We do have an opportunity within this project to test two distinct clients' questionnaire methods, the in-person exit survey for the health facilities and the patient digital platform survey. And finally, as we all know, staff shortage actually does lead to demotivation of staff at times and does negatively impact on respectful care sometimes. I would like to thank you for listening to me this afternoon. Thank you very much.